Welcome to another episode of the Back to School Shootings podcast. My name is David Reedman. I'm the creator of the K through 12 school shooting database. And I want to start today by reading a short passage from a book. So the passage starts, "The average American school bus carries 72 children. Imagine if every 6 days on a particular section of highway, a school bus crashed and killed every single child on board. Imagine if this went on for a year. Parents, politicians, and the community would be infuriated about why these horrible crashes were happening and demand that something be done to prevent them." So the guest today is the author of that book. And the book is called Saving Our Kids, an ER Doc's common sense solution to the gun violence crisis. So today's guest is Dr. Mark Gorelick. He is the president and CEO of Children's Minnesota. Mark, thank you for joining the show.
Thank you for inviting me. Appreciate the opportunity.
So before we get into talking about this book and talking about gun violence, could you just let the listeners know kind of who you are, where you work, what your history has been? Because it's pretty interesting about how you ended up to be where you are now.
Yeah. So as you've mentioned, I'm the president and CEO at Children's Minnesota. We're a pediatric health system based in the Twin Cities of Minneapolis and St. Paul. And I've been in this role for 7 years exactly. But my background has always been in children's health care. I'm a pediatric emergency physician by training. I practiced that for about 25 years before I moved into full-time leadership roles and done that in various places around the country. So my entire life has really been devoted to children's health and children's health care.
And your story starts in Washington, D.C., correct? Which is where I'm from.
That's where originally. I did my pediatric training, yep.
And what was it like, being a pediatric physician in D.C. back in the 80s?
Yeah, so this was in the late 80s. At the time, Washington, D.C., like a lot of large cities in the U.S. at the time, had a particular issue with violence and gun violence. It was, the number of places that were vying for the, quote, murder capital of the United States, but D.C. was certainly in the running. And I was at Children's National Hospital, which was the only children's hospital in the district and the only trauma center for kids. And so we saw, unfortunately, a large number of kids who were victims of that gun violence coming to our emergency room.
So then we transport back in time to October 19th, 1988. And the Washington Post, this is the 1980s. There's, limited kind of cable network news. Your local networks are big, but the Washington Post is the biggest source of information in the Washington area and one of the biggest in the country and the world. So October 1988, you publish an op-ed in the Washington Post. And I'm just going to read this op-ed because I think everything in it is still very applicable. "With the campaign against the Maryland gun laws in full swing, one large interest group is notable for its silence: our children. The danger of handguns to children should be self-evident, but the following facts may serve to reinforce the obvious. Firearms are second only to motor vehicles in causing accidental fatalities among children and adolescents. Many of these deaths are attributable to guns in the home. A recent study found that handguns meant to protect the family are actually 18 times more likely to kill a family member rather than an intruder. Carelessness in responsibility for a large number of these cases, especially among children. According to a study, 10% of families reported that their guns were always loaded, unlocked, and within reach of a child. And easily accessible guns are also a major contributor to the shocking epidemic of teenage suicide, currently the third leading cause of death among that age group. More than 2/3 of childhood suicides involve guns. Children cannot lobby, so it remains for those of us who must treat their injuries to make the case for them. Children cannot vote. Fortunately, their parents can." So, I mean, this is incredible. This is from, almost 40 years ago.
Yeah.
Now, and I think every one of the points in there is still valid, still important, but unfortunately, things have gotten worse. And that's part of what led you to write this book, right?
Yeah, so I wrote that when I was a second-year pediatric resident. Why I thought anybody cared what a second-year pediatric resident had to say, I don't know, but I did. Here we are, yeah, almost 40 years later, and guns have gone from being the second leading cause of death to being the leading cause of death in kids. Um, and this was a time when Maryland, I think, was proposing some form of a safe storage law. That's what I was alluding to. Still, many states don't have safe storage provisions or requirements in their law, and so access to guns remains a problem for kids and youth, uh, and the problem has certainly not gotten better since that time.
Yeah, I mean, kind of looking at the numbers now, there are on average 7 kids between 1 and 17 that are killed every day, and that's just killed. That's not counting firearm injuries.
That's right.
I mean, that's pretty staggering because I mean we talk really extensively about a school shooting that happened years ago that had 4 victims or 5 victims or 6 victims, but there are 7 kids being killed every day. Many of them are some of the most disadvantaged minority children in the country. Can you kind of what's the broader kind of causes of these firearm deaths?
Yeah, so for a while the number was actually going down slightly, and then really started to pick up in the early 2000s. And in the 90s, I think we saw some national action on legislation that I think helped, and we started to back away from that. But so a couple of things have happened. Other causes of death have fortunately come down, but gun deaths have actually gone up, and particularly since the late 2010s. What was really shocking was in 2022, we finally got that information that in 2020, guns had actually surpassed motor vehicle crashes as the leading cause of death in kids. And this was a bit of a wake up call. I mean, thousands of kids were dying each year, but this was like number one. I mean, how can that possibly be? And when you look at it, you're right. These school shootings get a lot of attention. They're horrific, but that's a very small percentage of these. In kids, somewhere around 60-ish% of those deaths are community homicides. One person shooting another person. Another about a third of them are suicides, somebody shooting themselves. And then the rest are those non-intentional ones. We've had 2 in Minnesota in the last 2 months. Within a 2-week period, a child finds a gun and points it and shoots somebody else. In one case, a sibling. In one case, a friend. So those are the numbers. So most of these are not. I mean, they should be newsworthy. It should be newsworthy when a child is shot to death. But most of these are not newsworthy events. They're unfortunately, as you said, every day, actually multiple times every day events.
And I think that we don't pay enough attention to whether you call them accidents or unintentional discharges or
Right.
negligent discharges, whatever. But that's actually a large portion of gun related deaths and injuries. Just in the school context where I look at,
Yeah.
just yesterday there were 2 different accidental shootings involving police officers at schools. In San
Mm-hmm.
Antonio, an officer was killed as he was getting ready for an active shooter drill and accidentally shot himself. And
Right.
in Delaware, a school constable accidentally fired his gun inside of the school. When that's adults, they often kind of happen around firearms handling. When it's children, it's most frequently children that are 4 years or younger that have fatal accidental injuries. That's because they don't even understand what the gun is, kind of
That's
when they pick it
exactly
up.
right. Yeah. So in the youngest kids, disproportionately these unintentional injuries. And you're right. I mean, there's research that shows that when kids find a gun, they'll pick it up, they'll play with it. First of all, the idea that parents have that somehow, oh, well, my gun's hidden, they're not going to find it. Absolutely, they will find it. I mean, there's plenty of research that shows that kids can find it, and when they find it, um, they can't tell the difference between a toy, between a real gun, and uh, and invariably something bad's going to happen.
Yeah, and that goes for vehicles as well. Just 2 weeks ago, there was a shooting at Dismissal at a school where a toddler found a gun that was inside the vehicle and started firing shots at the building, not knowing
Yeah.
what it was, not intending to harm anyone. But in addition to the home, in a lot of states, there's been a rollback of legislation around. It seems like common sense to not have a loaded gun stored inside a vehicle as you're moving. But that's actually something that's completely legal and unregulated in a lot of the states across the South and Midwest.
Yeah. Yeah, there's a variety of policy approaches, and we could talk more about this, but one of the ones that has been shown to be most effective in preventing at least pediatric gun deaths is some form of safe storage. Because if you think about it, kids under 17, they can't buy a gun. The only way they have access to a gun is if they steal it or find it. But it can't be theirs. And so this idea that if you are the owner, the legitimate owner of a gun, and you keep it stored in a secure way, that has a dramatic effect on the ability of kids to use them to injure themselves or somebody else.
Yeah, and then within the book, one of the important points you make, and just before we dive into this in detail, this is probably one of the most accessible books that I've ever read. It's less than 100 pages. The key points are bolded and bulleted. This is almost like the talking points that you would give for a political brief or a leader, a senior leader's brief about the key points of an issue. So I would highly recommend that anybody picks this up. But early in the book, you kind of lay out how guns are different when it comes to children, and how not all guns are the same. And I mean, we lump things into just one category, but between depending on caliber, depending on the amount of ammunition, depending on the size of the gun, the injuries can be very different, and they can be very different in children compared to adults.
Yeah, I mean, this is, first of all, as we'll talk about, this is not a law enforcement thing. This is not a political thing. It's a health issue, right? Kids are dying of this disease that is gun injury. And just like any other disease, there's an interplay of factors, right? So, whether or not, if you and I are both exposed around somebody with the flu, one of us might get it, one of us might not. Depends on our individual susceptibility, how we behave, all those things, right? Same thing is true with kids, right? What happens when a child is shot, or anybody is shot, is there is a projectile, a bullet that is fired, carrying an immense amount of kinetic energy, and that kinetic energy is transferred to the body. How fast it's moving, how big it is, the factors related to the gun and the bullet, and then also the configuration of the body. As it happens, younger bodies, because of the way they're configured, because of their composition, because of the child's shape, are more susceptible to a given amount of injury. So if a particular gun fires a particular bullet and it hits a 4-year-old, that's going to cause a lot more damage than if it's a 14-year-old than if it hits a 40-year-old. And that's an important factor. And so, when you look at, for example, the mass shooting at Sandy Hook, which was the youngest children, none of the children who were shot survived. Right? When you look at some of the older children, you can have shooting and survivors, but when a young child is shot, they're much less likely to survive that injury.
And there's also, distinctions there between a shotgun versus a small caliber pistol versus a large caliber pistol.
Right.
And
so
then
the factors about the gun and the bullet, that combination determines how much energy is delivered to the body, and that affects how much injury there's going to be.
I think that's one of the places where policy is failing in the country, is we have lots of things that are put under the same umbrella, but they're very different, and they present different levels of risk and different levels of consequence.
I think that's exactly right. Yeah. And we do, lump these things together. So one of the points that I try to make in the book is, if we think about this as a public health problem, which we should, there are these subtleties, right? When we talk about, for example, trying to prevent disease, we don't lump all germs together in the same category. There are differences. There are differences in how they spread. There are differences in what effects they have. The same is true for guns, right? So guns for hunting, guns for, recreation, guns for, military purposes, those are very different kinds of things, and they have very different consequences for the kids in particular, who might get in the way of the bullets that come out of them.
And we've been socialized in our lives to understand that there's different risk associated with different things, and that you as a consumer or an owner are going to deal with the consequences of that. If you have a Honda Civic or if you have a Ferrari, you're going to pay a significantly different insurance premium. So, when we have, a really established framework for motor vehicle risk, motor vehicle capabilities, consequences, and then ultimately what you as the consumer or owner are responsible for, even though we've made dramatic increases to decrease highway deaths, to decrease child and adolescent highway deaths and injuries, all sorts of safety mandates, we have not applied that type of risk-based calculus at all to classifying weapons.
I think, and your use of that example, I think, is perfect because one of the biggest public health improvements in the last 40 years for kids' health has been how we've dramatically reduced motor vehicle crashes, which for years were not only the number one cause of death in kids, but by a lot. And they have dramatically reduced because we took a public health approach to it. And it's a multifactorial, multifaceted approach that I think we have a lot of opportunity to do the same thing for guns, which is, at the end of the day, it's another consumer product.
Yeah.
If we took a similar approach to what we did there, we can expect similar results. And by the way, nobody's ever said that we're taking away anybody's cars, right? We get all caught up in the idea that, we have a right to gun ownership, and there is one. There's a Second Amendment right. And I think it would be foolish to think that the founders didn't think that there should be some special consideration when it comes to guns, or they wouldn't have put the Second Amendment in place. I think it's equally foolish to think that they wouldn't have contemplated there'd be regulation when literally one of only two places in the U.S. Constitution that the word regulated appears is in the Second Amendment. So it can be a both and. It's not an either or. And we don't have a constitutional right to cars, but nobody's had their cars taken away. There's plenty of cars in the United States to go around.
Well, it's fascinating to look back at old TV interviews from the 1970s and 1980s when some highway laws were changed, because actually people do kick and scream about their individual freedoms. How can I be told to wear a seatbelt? How can I be told that I'm not allowed to drink while I'm driving? How can I be told that my child isn't allowed to stand on the passenger seat when we're going down the highway at 80 miles an hour? How can I be told that I'm not allowed to smoke in the car with my children? And each one of those things gets enormous opposition up until the point that it's passed. And within a couple years, nobody cares. And then within a couple decades, people can't believe that it ever used to be that way.
You're exactly right. That's why I think it's such a great example, because it did seem like a huge intractable problem. And there are other public health problems we've had that seem huge and intractable, and yet we were able to make progress. And this one also feels huge and intractable. I said, here I've been in pediatrics for, almost 40 years. And over that time, this has only gotten worse. Of course, it feels huge and intractable. And yet I take hope when I see what we did with cars. I take hope when I see what we did with, other public health problems.
And then a mistake I think that's happened in the world of gun violence advocacy is the focus on gun deaths, the focus on mass shootings quantified by the number of deaths, because what that does is it completely ignores everybody who's wounded, has life-changing, life-altering consequences, very expensive medical care and surgeries, and it's actually far more likely than you're wounded than killed. For example, you cite in 2020 that there are 24,000 kids that had a firearm injury. So that's 10x the number of kids that are killed have a life-changing injury. Can you kind of talk through like what you see as kind of the typical types of injuries and just what somebody needs to understand about the magnitude and severity and life-altering impact of them?
Yeah, I mean, it's obviously a huge range, right? So, guns are particularly lethal. So, the death rate from a gun injury is much higher than the death rate from, say, falling or, stabbing or, other types of injuries. And there are, for every fatal injury in kids, there's, 5 or 6 non-fatal injuries. So that's a lot of kids, each year. Those non-fatal injuries can go anywhere from, a relatively minor laceration that needs suturing, all the way up to, a life-changing injury with spinal cord injury and long-term consequences. But when we think about, the consequences, there are the physical health consequences. And there's studies that show that people, including kids who suffer gunshot injuries, that they survive, have higher rates of, poor physical functioning, chronic pain, other sort of physical manifestations of that injury. Even more than that are the psychological manifestations of that injury, right? Because there's not only the child who is shot, who often has long-term psychological impacts, ranging from anxiety and withdrawal to depression, post-traumatic stress. Their family members, their friends, also have higher rates of that. So that the physical impact is limited to the person who shot. The psychological impact, it ripples out beyond that, and even community-wide. So for kids in particular, there's some studies that have found that kids who witness gun violence, either directly, they see somebody shot, or just hearing gunshots in their community, have higher rates of, mental health consequences, again, withdrawal, anxiety, depression. And it's incredibly common, especially in some communities. This one study that looked at 3 different communities in the U.S., so Philadelphia, Boston, and a rural Tennessee community. So very diverse demographically, economically, et cetera. Over 25% of the youngest kids, less than 10 years old, heard gunshots out in their community. 50% of the kids between 10 and 17 did. So half the kids in this community have an exposure to something that puts them at risk of mental health problems. And we wonder why we have a mental health crisis in our country. Clearly this isn't the only factor, but a contributing factor to the increase in mental health issues that we see in kids and teens is the community levels of violence that they are exposed to.
Yeah, and there are very few resources that are available to most people, most kids. If you're just wounded in a school, there's usually not a GoFundMe for you.
Right.
There's not ongoing resources. The state is not going to pay for the cost of your injuries and therapy. And if you witness something, you're really on your own to deal with that. There's a pretty powerful story from the country music star Kelsea Ballerini. She was in high school when a student committed suicide in the cafeteria of her school, and she witnessed that, and it was really traumatic for all the students there. And she did an interview a couple of years ago where she talked about how 15 years later, despite going to therapy almost every single day, that she still has panic attacks and nightmares about that. And that's somebody who has incredible resources to be able to have a therapist and be able to have somebody. Most kids that experience a shooting don't have anywhere near those resources, and your health insurance doesn't cover in most cases talk therapy or any sort of therapy.
Yeah, it's a really powerful story, and of course there are some communities where it's just so common. I mean, we had a panel discussion yesterday on this topic, and one of the folks that was participating leads a community organization in North Minneapolis, and she was pointing out that every time there's a child who's shot, there's a teddy bear hung on the tree, and someone came by and visited, and they saw all the teddy bears, and they said, "What are the teddy bears?" And she said, "Well, that's where somebody's been shot." And she said, "Are you telling me that somebody's been shot near all of those locations?" She said, "That's the reality in our community." Well, when it's that widespread, everybody's exposed, everybody's seeing it, everybody's hearing it. Everybody can't get to therapy. I mean, it just becomes routine, which is part of the problem, right? We become immune to this, and it's at the point where not all of the kids who are shot make it into the news.
No, not even all the kids.
Just part of the background at some point.
Yeah.
And that has, again, it has mental health consequences, financial consequences. So it is truly a public health crisis that we are in.
Now, in your book, I think what's also interesting in the way that it's structured is a lot of kind of policy issue-based books are 90% the problems, and the last chapter is a couple of solutions. But really, about two-thirds of your book is talking about specific solutions. And when you're talking about things that everybody experienced, you draw on the COVID pandemic as actually a template for how we can address a really challenging public health crisis. Because COVID was something that every single person, whether they wanted to or not, was forced to experience and deal with COVID. And you look at the COVID response through a three-legged stool model, through kind of a pyramid model, where it's the biopsychosocial
Right.
model of these biological factors, these psychological factors at the individual level, and then the social factors within the community and the country. Can you first kind of talk about that model in the context of COVID?
Yeah. So, part of what motivated me to actually write this book was, you know, in, again, in 2022, when we learned that this was the leading cause of death of kids, a lot of people stood up and took notice. And we said, wow, this is a public health crisis. And people came out and said it. We in the Twin Cities, all the leaders of the largest health systems in the state, we took out an ad in the paper. We said, this is a public health crisis. The Surgeon General recently declared it a public health crisis. And I thought, we just had a public health crisis, COVID. We are not acting like gun violence is a public health crisis. We're saying it, we're using that phrase, but we are not acting in the same way. Because to your point, there were a few factors. One is nobody could escape COVID, right? People can pretend that somehow gun violence doesn't affect them, although I would argue that it affects all of us. But you couldn't make that case for COVID. Everybody had to pay attention. And we recognized that there wasn't a single thing to do that was going to solve this. We had to look at it through that public health lens, that biopsychosocial model. So we had the virus, right? There were things about the virus. There were things about our behaviors that affected whether or not we caught the virus. There were things about the wider society that affected whether or not we were going to get sick and what the consequences would be. And the things that we did in those first months of the pandemic were targeting all of those things. Before we knew a ton about the virus, it was focused on the behaviors. Wear a mask, wash your hands. It was focused on social policies, closing, public places, social distancing, et cetera. As we learned more about the virus, we were able to do specific things. We developed medications and ultimately a vaccine. But all of those things had an interplay. And it's the same thing with the gun problem, right? Safe storage is a really important step. It's not going to eliminate gun injury. Addressing mental health is an important step. It's not going to address all gun injury. Limiting violent video games with guns in them may be an important step. It's not going to solve gun injury. We need to think of all of those factors in that public health triad, that biopsychosocial model, and we need a variety of approaches to address them.
And what is, really different with guns rather than COVID, and unfortunately COVID became political, but, in the essence, in the start of it, public health has largely not been political for most of our history.
Right.
Environmental health really wasn't political for most of our history. Unfortunately, in the past 20 years specifically, guns have become really a galvanizing political issue, to the point that you mentioned the Surgeon General, Dr. Vivek Murthy. His appointment, he's an extremely qualified person to be the Surgeon General.
Mm-hmm.
And when he was first put forward by the Obama administration, his appointment was held up for 14 months because of statements that he had made about guns being a public health issue. Not about taking away rights, but just saying we need to acknowledge this as a public health issue. So before we can even kind of get into a biopsychosocial model for the way that we address gun violence, what needs to happen and change? Because the Surgeon General has said this is a public health crisis. Half of the country either ignores or doesn't believe that. And many policies have been passed in the last couple of years are going to immediately get rolled back.
Yeah, I think, we really do need to, and this is not an overnight process, but we really need to shift the way that we think about it and talk about it. For too long, people who wanted to do something about this talked about it as a gun problem, right? And we talked about gun control, right? It's not a gun problem. It's a gun injury problem. So on the one side, there are folks who want it to be about guns, and the other, there's was who thinks about is it a criminal justice issue? Well, you don't follow the law, you get what's coming to you. And so I think, we have an opportunity to focus it as a health issue. And where I take heart is we've had a few of these other issues. I think about, for decades, alcoholism and drug abuse were seen as moral failings or criminal justice issues, right? Drugs were a crime issue. And by and large, we don't say that anymore. We see alcoholism and substance abuse as a disease. And, talk about a partisan political issue. I mean, there was a political party founded on the issue of banning alcohol in the 1800s, right?
Which it was for a period of time.
Correct, and that didn't really work. But we've had to make that shift, and now that we've made that shift, we're starting to see improvements, right? And even the opioid crisis, now that we're thinking about it as a public health issue, and we're starting to do things like, yes, there's a law enforcement piece of it, if stopping illegal drug trade, but there's a training people in how to recognize and treat overdoses, putting opioid reversal agents out into the public's hands, things like that. Looking at the biopsychosocial model, we're starting to see those opioid deaths come down. So, but it started with seeing it not as you're a bad person, you made bad choices, or you're a criminal. It's you have a disease. You have a disease called substance use disorder. And the approach to dealing with that disease has to deal with the agent, the opioid, you and your behaviors, and the larger societal context. So it's going to take some time to get there, right? I mean, and we're not quite all the way there yet, right? There are still people who talk about, alcoholism and substance use as moral failings, but we've come a long way, and certainly within the medical profession, the public health profession, and among policymakers, we see those as diseases now. When we start to see gun injury as a disease and talk about it, that's going to help us, I think, get over that hump. And that's one of the pleas I have in this book is for us to help people see it that way.
And a challenge with that, especially as it applies to children, is that with alcoholism or with illegal drug use, the perpetrator and the victim are usually the same person.
Mm-hmm.
Whereas with guns, the person carrying the gun, the person shooting the gun, and the person who's the victim are maybe three different parties
Right.
in a lot of places. And that creates this diffusion of responsibility, and it creates a more complicated psychological and social layer to your model, because now you have these different actors with different motivations all contributing to the issue.
It does. And at the same time, it gives us an opportunity because, with, say, drug abuse or alcohol abuse, it's easy to say, well, your choice, you have what's coming to you, right? You have to suffer the consequences of your decisions. Nobody thinks it's normal for a child to be shot, right? People can make the arguments about, well, if adults, if they put themselves in a risky situation, they make bad choices, blah, blah, blah. Nobody thinks it's normal for a child to be shot, either by somebody else or themselves. And so I do think, clearly the gun problem is a problem for adults as well. But I think we have an opportunity because nobody sees children, everybody sees children as the innocent victim, helping them recognize, yes, and this is a condition, a disease that is affecting them, that they didn't ask for, they don't deserve, might help us with that reframing. Sometimes kids can be that nose under the camel's nose under the tent that gets attention in a way that it's harder for adults, because people make moral judgments about adults that they may not be willing to make about kids.
So then, kind of expanding on your COVID example, you lay out how it's the blueprint for solving this crisis. What's the step that needs to happen for something to have much wider adoption, between, there are individual communities that are interested, there are individual states that are interested. But
Right.
when we have this hodgepodge of different policies, it's easy for, even if Minnesota says we're going to implement this model, for guns to come from elsewhere, for influence to come from elsewhere. Um, what do you see as kind of these first steps in how we move towards implementing this model in a meaningful way in kind of all parts of the country?
Yeah, I think first of all, in terms of trying to sort of moving this conversation, I think the healthcare community needs to step up, and in many ways they have, and we can do even more. Um, Stepping up in our role as individual clinicians, normalizing discussions about this. When someone comes in to a clinic or emergency or whatever, we ask about things like, do they have any drug allergies? Are they taking any medications? We should be, we ask about risk factors for illness. Guns in the home is a risk factor for illness. Normalizing the discussion of that. Do you have a gun at home? How is it stored? If it's a child, does your child visit guns, homes? Do you ask about that? So I think we have an opportunity to normalize that conversation one at a time. I think we also have the opportunity to use our voice to advocate. That's what I'm trying to do. That's what I would like my colleagues to do. There's plenty of studies out there that show this is a really widespread problem. I think one of the things is, again, COVID, initially it was like, oh, there's a thing in China or in Italy. Well, no, it came to the US and it rapidly spread across the US. You couldn't ignore it. It's easy for people to try to ignore this because they think, oh, that's happens in, this poor community or that poor community. It happens in every community. Kids are being killed in every congressional district in the United States, in every zip code in the United States. So this is, we do have that opportunity as clinicians to raise awareness of the problem in our own communities. So I think using our voice to frame the conversation as, yes, it's a problem. Many people don't know yet that guns are a leading cause of death. When I tell people that, nobody fails to go, it literally takes their breath away when I say that. So let's make people aware. Let's help them understand how it impacts their community. That's one. The second is to use our influence to try to advocate for some of the at least easier, less partisan approaches. So if we think about the biopsychosocial model, what are the things that we can do to address, for example, how people store their firearms, advocating for policies around that. And, there's a carrot and a stick approach, right? You can say you must store your firearm safely, or you can say, how can I make it easier for you to store your firearm safely? Different approaches are going to work in different places, but whatever it is, how do we actually get that, I'll call it the vector of disease, the gun bullet combination, out of the hands of kids, safely stored? How do we address the mental health issues? How do we improve, screening for depression and that kind of thing to help with the suicides? And how do we start thinking about the social milieu that makes it normal for kids to carry guns, to fire guns? And I don't want to get all Tipper Gore and say it's, stop banning violent video games, but how do we look at media, social media, and start to think about ways to change them in ways that would create a positive influence?
Yeah, I mean, there's, from the tobacco industry, there's like a very clear path forward for when something has clear harm to children, that you don't make it accessible to children, and you are not allowed to have movies or TV shows or advertisements
Yeah.
that are showing that product to children. I think I just want to get back to one point you made about the role of an individual physician. I think in the context of COVID, there was a large portion of the country that had distrust in national level public health policy. But even within those communities, there was still a high level of trust in one's either family doctor or the physician that is directly caring for them if they're sick or injured. And that's because there's a personal relationship, there's authority, there's the kind of existing trust that's been built over time with your family doctor. It seems like that is really an important space to have just frank, open, not scripted discussions with people about gun risk, about that chance of a gun in the house killing your kid instead of killing an intruder is 18 times higher. That's, I think those are the things that people really need to think about and know. Like a parent who has a gun in their house is thinking that they're being a patriot or a protector because the gun industry has tricked them into thinking that there's an intruder that's going to come through the door. But
Right.
if somebody they trust can tell them, no, the most likely thing to happen in your house is your kids and their friends are going to find it and one of them's going to end up dead. That's a much, much different story.
I think you're exactly right. And I think there's a couple of things. First is you're right. There's a lot of lack of trust in general in our society, and particularly for institutions. That goes for government, that goes for the public health system, that goes for health systems, right? The healthcare system. But it doesn't apply as much to individual, there's been a little bit of slippage, but if, surveys show that nurses, doctors, other individual healthcare providers remain among the most trusted people. So that's one. The second is, really, we need to be more willing, and I do this a little bit in the book, be willing to share our stories. Um, you know, um, it was Joseph Stalin who said, one death is a tragedy, a million deaths is a statistic. Statistics can be cold and overwhelming, but when most of us have personal experience. I mean, there's surveys that show pediatricians, 80% of them have some personal experience with taking care of somebody who's been a victim of shooting. Talking about the girl I saw who found her father's shotgun and killed herself or tried to kill herself. The kid who found the gun, we can share those stories to make them real. 18 times more likely. I mean, I think that's very compelling. That can gloss over people. Well, that's not my kid. But if we can, as clinicians, be willing to share our stories and maybe even get a little bit graphic, about what that means, that also, I think, is potentially a step that we need to be willing to take.
Yeah, and there's really important messaging and research around risk perception, and people tend to misperceive risks to themselves, either even when they can really accurately perceive them to their neighbor. There was a famous study around earthquake risk, where people in different communities were asked about earthquake risk, and they basically said that they themselves had none. But when they were asked, "What are the chances of your neighbor's house being destroyed?" they actually projected that very accurately, even with the different community interests. So maybe those conversations with the physician should be around, talking to your neighbor, imagining how traumatized your kids would be if their friend, if their neighbor got killed by that gun that's unsecured in their house, and taking it out of your house and putting it into a place where you can perceive,
Yeah.
risk more accurately.
Yeah. No, that's a great point. And I think, everybody responds a little bit differently. So you need to understand, one of the things that I think has made a difference over time in some of these campaigns that we talked about, so motor vehicles, for example, smoking, has been, sort of how do you change the conversation on a national level? And number of health systems and health system organizations have gotten together, working with the Ad Council, that will be working on a fairly significant sort of public messaging campaign around the issue of gun violence in a way to try to, just the way that you said, we moved from like, what do you mean I'm supposed to put on a seatbelt? I mean, I still remember some of the ads from when I was growing up. Very vivid memory of the ad about the woman who was worried about her dress getting wrinkled and didn't want to put on her seatbelt because she was just going to go around the corner and, I don't want to wrinkle my skirt. And, she's talking from the grave, right? I was probably 6 years old, and this is seared in my memory. So there's going to be an effort going on around that societally, but we also have these opportunities for one-on-one conversations. The other thing I think that we need to be thoughtful about, and, maybe this is because I'm getting old and I reckon, with age comes, enough disappointments that you realize you can't always have everything. We do need to, and I think we too often in many communities, including the gun safety community, can get too absolute, right? And this is where I'll probably differ with my colleagues a little bit. Safe storage is, locked, unloaded with the ammunition in a separate place. That's ideal. But you know what? If it's just locked in a safe, that's a whole lot better than not being locked up at all. And many people who think they a gun is going to help them protect themselves, they're not going to be willing to do that. Um, and, I heard an interesting presentation from the CEO of Intermountain Health in Utah. Very red state, highest rate of gun ownership in the United States. They've been very successful with distributing gun safety devices because they talked to folks and folks said, look, I don't want my kids to get my gun, but I want to be able to get it when I need it. And those locks, they're fumbling. But if I could get one of those safes that opens with a fingerprint that opens instantly, I'd take that. So they started distributing those, and there was huge uptake. So I think we do need to be willing to meet people where they are, except for the time being half measures. Half is better than nothing. And I think there's been a little bit of unwillingness to be willing to take first steps. And I think we have to be willing to do that.
Yeah, I also, wonder when you discussed, that there are carrots and there are sticks. I mean, obviously, this is a rough week for the medical insurance field. But should gun ownership and gun storage be something that's priced into somebody's health insurance? Because I think that if that was a question, it's pretty easy to pull records and figure out who's purchased or who has a gun, or have somebody prove that they have a gun safe or not. If you had to look at your policy price and see that, your biweekly paycheck, it's $250 that's coming out for your regular insurance. If you have a gun without a safe, that's gone up to $1,500.
Mm-hmm.
And, by having your safe, maybe that drops it to $450. If people had to deal with those kind of finance, life-altering consequences, because the insurance companies are paying the price. Healthcare systems are paying the price.
Mm-hmm.
We're all paying the cost
Right.
of these injuries. Is that something that should change?
And the carrot version of that is it's something that's covered. If you want birth control pills, those are covered by your insurance. You want a gun safe, that's covered by your insurance, maybe with a $50 copay or something like that. So that's there are different ways of structuring it, but how do we start to think about safe storage devices as a health prevention measure? And we have most health prevention measures. Many insurance companies will pay, offset the cost of your gym membership because that's a health prevention measure. Why couldn't that be true for some of these other things that might help prevent this form of injury, which, as you point out, is a direct cost to the healthcare system, which is borne by the insurance system, and then of course all the indirect costs that are borne by society that would argue for wider societal support for financial support for those preventive measures.
Yeah, imagine the gun safety education that an insurance company could put on. If that's a question for your insurance and your rate is going to drop if you go to a 2-day training that's provided by your health insurance company, and they teach you about firearm safety, they walk you through the impacts, they walk you through the costs and consequences of injuries to children. That could actually be an extremely powerful and useful way to reach people, right. and they would have to kind of elect into it.
And this is what I love about this conversation. This is exactly what I'm talking about. We are talking about this just like we're talking about all the other diseases and conditions that affect us, right? How do we build this into the health insurance system? How do we think about, supporting preventive measures just like we do for, a whole range of other medical conditions, health conditions? This is a health condition.
So my final question for you is, already there's a lot of national level discourse about changing gun laws, having a national right to carry, having a national concealed carry. Already in Florida yesterday, there was a state bill proposed to repeal the state's red flag laws. There is going to be a tremendous amount of national level energy into making guns more accessible, with less training and less oversight and less care given to kind of preventing child injuries. What can people do in their home and their community to still make a difference, even if things are going in the wrong direction at the national level?
Yeah, I think, just like any public health issue, there's individual actions that we can take, there are community actions we can take, and then there are, larger actions in the political system. And so, for parents, if you have a gun, store it safely. If your child goes to somebody's house, ask if there's a gun and if it's stored safely. Um, you know, Advocate at your school level, your school boards for policies. Work with community-based organizations that are doing great work on addressing some of the root cause factors of gun violence and gun injury. Um, you know, uh, um, I think if we think about, the public health model, we talked about the triad of, the three factors. There's also a variety of approaches that need to be taken, and none of them is sufficient. We need policies, we need education, we need community action. Those are the keys to a public health approach. Same was true with COVID, same is true here. And if the policy arm is going to be weak for a while, we have to lean in on those other two arms of individual action, education, and community action.
Well, thank you so much. Dr. Mark Gorelick is a pediatric physician. He's also the president and CEO of Children's Minnesota. His new book, Saving Our Kids, an ER Doc's Common Sense Solution to the Gun Crisis, there's a link below in the show notes. And again, this is a 100-page book. This is one of the most accessible things that you can pick up and read. I'd highly recommend it to everyone. Mark, thank you so much for being on the show today.
Thank you, David. Really appreciate it.